The member from Elgin Middlesex, London.
Thank you, Speaker. Speaker, my question is to the Premier. Speaker, every day the real cost of this Liberal government's scandals, waste and mismanagement is being felt by Ontario's families and seniors. Money that should be invested in frontline health care is instead being spent on cancelled gas plants. In order to pay for their scandals and waste, this government has cut $815 million from physician services, 50 medical residency spots, and $50 million in seniors physiotherapy services. These cuts mean that patients are not receiving the quality health care they deserve. Mr. Speaker, will Thursday's budget properly fund health care in Ontario, and will there be more cuts?
Good question. Thank you.
Thank you very much, Mr. Speaker. Well, I know that the Minister of Health and Long-Term Care is eager to chime in on the supplementary, Mr. Speaker. Healthcare is a priority for our government, Mr. Speaker. It has been and will continue to be. Since 2003, hospital funding in Ontario has risen from $11.3 billion to $17.3 billion, Mr. Speaker. That's a 53% increase. We're investing $11 billion to expand, renew and modernize hospitals, Mr. Speaker, so those are capital dollars to build up the hospital system, Mr. Speaker. We're increasing our investments in home care by 5%, which will those investments will grow by over $750 million over the next 2 years. Funding for community supports increased to almost $514 million this year, Mr. Speaker. That's an increase of $41.9 million over the last year. Mr. Speaker, in every aspect of health care, funding has gone up. We understand it's a priority. We will continue those increases, Mr. Speaker.
Thank you, Speaker. Speaker, back to the Premier. In addition to the $815 million cut from physician services, this government cut $54 million from the health care budget last year, despite a 6% increase in the federal government's health transfer. Because of that cut, and cuts to physiotherapy and eye care, Ontario patients are suffering, and it will only get worse. This Liberal government is so out of touch, they refuse to admit their cuts are forcing doctors to close practices and forcing hospitals to fire nurses. Mr. Speaker, when will this government put patients first? Will Thursday's budget reverse the cuts to doctors, nurses and hospitals?
Minister of Health and Long-Term Care.
Well, Mr. Speaker, I don't know how an increase in our budget for health care, an increase in the budget for our physicians, how that can be somehow at all translated into the sorts of cuts that the member opposite has alluded to. In fact, Mr. Speaker, with regards to our doctors, we had a year of negotiations that led, unfortunately, to no agreement, but we brought in an umpire, third-party adjudicator, that gave us the best recommendations and implored the OMA to accept what he viewed as a fair offer by the government of that time. Unfortunately, the OMA did not accept his recommendation, retired Judge Winkler's recommendation, and we had to make some changes in order to put patients first, in order to invest an additional $250 million in home care, in order to invest more in mental health services, $138 million of new money over the next 3 years. Those are investments that are important to Ontarians. Notwithstanding that, Mr. Speaker, our doctors are the best paid in Canada.
Yes.
Thank you. Final supplementary.
Thank you, Mr. Speaker. Back again to the Premier. Premier, when you cut frontline healthcare professionals, you are cutting patients' quality and access to health care. I wish you'd get that right. Mr. Speaker, this Liberal government continues to spew out their fictional figures, and the numbers just don't lie. I'll give you some. 10 nurses were cut at Almont General Hospital, 17 nurses cut at South Lake Regional Healthcare, 20 full-time positions gone in Aurelia Soldiers, 33 job cuts at Cambridge Memorial, and 350 full-time positions gone in the riding of Nipissing at the North Bay Regional Hospital. All of these cuts were done in the last year alone. Each cut translates into reduced health care for Ontario's patients. Mr. Speaker, when will it stop? Why won't this government put patients first? Stop and reverse the cuts.
Thank you, Mr. Speaker. Well, you know, here are some important figures I think that the Ontario public would appreciate hearing as well. The PC government of Mike Harris fired 6,000 nurses, Mr. Speaker. And in fact, we know in the last election campaign, they were campaigning on eliminating 100,000 jobs in the broader public sector. That would have translated into approximately 5,000 more healthcare workers losing their job.
Well, the member from Simcoe Grey should look to see that I'm standing. Finish, please.
Well, what have we done, Mr. Speaker? We've increased the number of nurses that are practicing in this province by 25,000 since we came into government.
I'm not going to play the game of yo-yo. When I sit down, you start. And if it starts again, I'll warn the member. Carry on.
We've increased the number of nurses working full-time in this province
Answer.
by 30%, Mr. Speaker. We're adding 900 net new doctors to the province this year alone, Mr. Speaker, and we continue to make important investments, including in home care and mental health services.
Thank you.